We will go ahead and start out with the agency updates. We have a full morning with safety of Tdap vaccine, human papillomavirus, smallpox vaccine. I don't believe I've seen any public comment here as of yet. So without further ado, if we can go ahead and ask for the update from CDC and Dr. Schuckett.
Yes, I just wanted to let people know that the week of April 28th will be our next National Infant Immunization Week. And this year we're going to try to mark the 20 years since the Vaccines for Children program was implemented as sort of a special highlight to that. I also want to let people know that there was a recent issue of the Pediatric Infectious Disease Journal that highlighted the rotavirus burden in Africa as a way to really promote the introduction of rotavirus vaccines throughout Gavi-eligible countries. And the last thing was to inform folks who haven't already heard that we have established an intergovernmental board, kind of like an ACIP, but it's intergovernmental, to advise us on immunization information systems and our strategic plans so that we can get the best of the federal, state, and local governmental IT thinking about how to best improve the immunization systems, information technology underpinnings.
Thank you. Mary Beth Hans is not here today, but I do have an update from CMS that we were requested to read into the record. So for the Medicare flu vaccine data, CMS has worked with the Health Resources and Services Administration and the National Vaccine Program Office to post Medicare flu vaccination information for those in fee-for-service on the NVPO website. And I believe everyone has or knows what the website is. And this is updated weekly. Coverage of preventive services for adults currently enrolled in Medicaid. While the benefit package for adults who receive health care coverage under the Affordable Care Act is required to include coverage of preventive services, including coverage of all ACIP-recommended vaccination, states continue to have the option to cover preventive services for adults currently enrolled in Medicaid. The Affordable Care Act addresses by including a provision, Section 4106, that provides an incentive to states who provide coverage of all ACIP-recommended vaccines and their administration, as well as the Grade A and B U.S. Preventive Services Task Force recommended services. To date, 11 states have submitted a request to CMS to cover these services and receive the incentive, and 8 states have been approved: California, Colorado, Kentucky, Nevada, New Hampshire, New Jersey, New York, and Ohio. CMS continues to work with all states to encourage coverage of preventive services. That ends the report from CMS. Yes.
I just want to note that this really does have meaningful impacts for many, many, many of the people that we talk about in our work. And in particular, March of Dimes is working with a number of states. For example, Louisiana right now is not covering Tdap for pregnant women.
Next, we have Department of Defense.
Yes, good morning. Jesse Geib here representing Department of Defense. Just a couple of quick updates with regards to influenza. DoD service members, that includes active duty reservists and National Guard, reached a 90% vaccination rate back in December, and they're currently at about 95%. The challenge with us always seems to be catching up with the reservists and so forth because they're spread out. And of course, I'm in great competition here with the VA and the Indian Health Service, but we can force our folks to get those shots a little quicker, so it always works out. Next issue, Japanese encephalitis. There's been ongoing efforts in Japan and Korea to expand our screening and vaccination based on areas of risk, and that continues to be a challenge, but ongoing work in that area. With regards to human papillomavirus, we are offering the vaccine to males and females during their routine appointments, and we're working to target now the adolescent population to help improve completion rates as well. Smallpox, we recently updated our screening forms to clarify questions, ensure safety based on customer feedback, but no real changes in our program. And then lastly, I was going to comment on adenovirus. We're continuing to vaccinate against types 4 and 7 adenovirus. That was instituted in all military basic training centers back in November of 2011. Since then, we've seen febrile respiratory illness rates and the proportion of febrile illness related to adenovirus among the recruit population dramatically decrease. In fact, in 2013, we've only had a few rare sporadic cases in the recruit population, so it's proved to be a real success. And that's all I have. Thank you.
Thank you. Department of Veterans Affairs.
Good morning. Just a few things to mention. We've recorded nearly 2 million flu doses to our veteran patients so far, and continuing to promote the delivery of flu vaccine. Our flu surveillance data matches very closely with the national trends in terms of the number of cases and the proportion of influenza A and so on. We're also seeing, in terms of hospitalizations, the largest age group is that 45 to 64-year-old age group, just as in the national data, so very similar trends in our population. We are working on a number of immunization IT-related projects, trying to improve our data collection and data records so that they're easier to use. Our wonderful electronic medical record, which we've had for a long time, was built over the years sort of locally, and now we're at the point where we need to make it all work much more carefully together. And so we're working on a number of things, including a project with the Indian Health Service and the CDC to look at a composite flu measure, or a composite vaccine measure. And then the last thing is that we've been working to improve information for our providers, and we've developed 2 algorithms, one for the pneumococcal vaccines and one for the meningococcal vaccines, because there's just such complicated recommendations that we decided that we needed a visual way of doing that. So we've got nice graphics, that algorithms that walk people through exactly when to give which vaccine. We think those are very useful.
Very good. Thank you. FDA.
Good morning. So just a couple of highlights. Since the last meeting here in October, in November 2013, we approved the QPAN H5N1, which is a adjuvant influenza vaccine that has an indication for those over 18 years and older. As a 2-dose vaccine given 21 days apart. The vaccine is mixed right prior to administration, and on the other updates, as you've heard yesterday, have been working very closely with the CDC and the sponsor on addressing the use of group B meninge vaccines for the outbreak on college campuses. And then lastly, February 28th, tomorrow, is our advisory committee for the 2014-15 influenza strain selection. Thank you.
Thank you. HRSA.
Good morning. A few highlights that I'd like to share with you today are that the notice of proposed rulemaking to amend the vaccine injury table to add into susception as an adverse event associated with rotavirus vaccines was published in July 24. The public comment period has ended, and there will be a second public comment hearing that will be scheduled soon. The Advisory Commission on Childhood Vaccines made recommendations to amend the vaccine injury compensation table during the September 5th and December 5th meetings, based on the Institute of Medicine's review of the scientific literature on vaccines and adverse events. These recommendations are being considered. And finally, there are increasing numbers of petitions that are being filed with the National Vaccine Injury Compensation Program each year. In fact, it has increased by 100 petitions from 2012 to 2013, and more claims are being compensated each year.
Thank you. Indian Health Service.
Good morning, Amy Groom with the Indian Health Service. Just some preliminary data on our healthcare personnel vaccination for flu. After our 4 years of sort of stagnating and remaining at about 74%, we've had a slight increase this year. So our healthcare personnel flu coverage is about 78% now. So still far short of the Healthy People 2020 goal, but at least we're making some progress. The other thing that I would just wanted to report on is the composite measure work that we've been working on in collaboration with the VA. And we're actually looking at a developmental performance measure for the Indian Health Service that would look at a composite measure for adults. So looking at what proportion of adults have been appropriately vaccinated for age with the routinely recommended vaccine. So we're considering rolling that out to our sites, and we'll be collecting some developmental data on that. Thank you.
Thank you. National Vaccine Program Office.
I'm going to talk a little bit about the last National Vaccine Advisory Committee meeting, which was on the 11th and 12th of February. A couple of issues that I want to focus on. We had a forum on vaccine research, development, and innovation. And this included a demonstration of the IOM developed smart vaccines tool and looking at various values of cost, health burden, effectiveness, safety, and public demand, and how that influences vaccine priorities and ranking. We also heard from BARDA as how it incentivizes development of products that it considers high priority. And a stimulating talk by Stan Plotkin dealing with issues of stimulating development of new products and high priority products, and we will continue to follow this. The standards for adult immunization practices is now published in public health reports, and we heard about plans to implement them and track implementation. And then we've got 3 working groups that are continuing to go on. One is on vaccine acceptance and confidence, and a second is on HPV vaccine. And we heard a report from the President's Cancer Panel on trying to improve uptake, and that report is available on the NIH website. And then finally, we have a maternal immunization working group dealing with how do we improve implementation of ACIP recommendations for vaccination of pregnant women. And they have are looking at NVAC comments now and expect to put that out for public report sometime during the second week of March, with the final vote on recommendations at the June NVAC meeting. And the report does have something specific that it mentions ACIP, and that is the issue of urging ACIP to consider developing a statement for pregnant women, so that for obstetrical providers and others, there would be one place to turn to get information on that.
Thank you. And Bruce.
So for the National Vaccine Program Office, a few things have already been mentioned. I'll highlight. One is from the CMS report included the highlighting of the flu map, and I would actually encourage you to take a look when you get home and look at what you can drill down to your community and see what flu looks like in the CMS population in your community, and it's interesting to see that. And we've had great feedback from NACCHO on how helpful this is at the local level. We've also, related to that, been working with the Health Map folks at Harvard, and you may recall it was initially the flu vaccine finder. That's now morphed to the adult vaccine finder, part of a larger effort to encourage adult vaccination more broadly. Walt mentioned the IOM Smart Tool. You can go and look at it and play with it on the IOM website, and we hope to have them give you a demonstration at the June meeting if we can organize that. Walt also mentioned that we had the first report on the national vaccine plan, first annual report on the national vaccine plan. It too is on our website, and again is give you a sense of where we are in the progress towards that plan. And particularly, I was excited about having outside commentaries from a number of people in the field who you recognize to give their perspectives on where we are. I did want to announce the good news and bad news is the funding opportunities is the good news. The bad news is it's due on Monday. But for those who are interested and can type, have a look. It's entitled Mobilization for Health National Prevention Partnership Awards, and it's recognizing the importance of partnership. It's on the Assistant Secretary for Health's website. So if you're interested, if you Google those key themes, you'll find it. But you have until 5 o'clock Eastern time on Monday. And then finally, that about a year ago, or late last March, we had a meeting on pertussis, and that is working its way into a JID supplement that should appear next. That's it for mine. Thanks.
Thank you, and NIH, Dr. Berman.
Thank you, Dr. Tempe. I'd like to highlight three things that are going on at NIH. One is sort of a promissory note. There is a new series of efforts for developing a vaccine to protect against the respiratory syncytial virus, which is a leading cause of illness and hospitalization among very young children. There has been a recent report in Science. There will be a written copy of this into the minutes with the links to all of these documents that I'll be mentioning. There's been a recent report in Science from an NIAID researcher, and 2 pharmaceutical companies are also working on early-stage respiratory syncytial virus vaccines, and they will soon be moving into early clinical trials. In terms of partnerships, the NIH has entered into the Accelerated Medicines Partnership. The Accelerated Medicine Partnership is a venture between the NIH and 10 biopharmaceutical companies and several nonprofit organizations that hopes to transform the current model for developing new diagnostics and treatments by jointly identifying and validating promising biological targets of disease. The ultimate goal is to increase the number of diagnostics and therapeutics for patients and reduce the time and cost of developing them. For each pilot that the NIH and the industry select, they'll develop research plans aimed at characterizing effective molecular indicators of disease called biomarkers and distinguish biological targets most likely to respond to new therapies. And the third and last thing that I'd like to highlight is the NIAID's antibacterial resistance program. There's a report that has been recently published that describes our ongoing research portfolio of the basic translation and clinical research in antibacterial resistance, and the combination of hopefully innovative approaches based on the latest scientific advances to be pursued. These strategies draw on multidisciplinary partnerships which are essential for achieving a coordinated and nimble approach to addressing antibacterial resistance threats as they emerge. Since that report has been published less than 2 weeks ago, we've been approached by another consortium of pharmaceutical companies to create what is called a living protocol, which I hope to be able to report to at the next meeting.
Thank you.